21st International AIDS Conference in Durban. We're live to Blaine Herman at the International Convention Centre, where strengthening community-led responses to tuberculosis comes into sharp focus.
TB is one of the leading killers of HIV-positive people. Now, people who are infected with HIV are said to be 20 to 30 times more likely to develop TB. This is indeed shocking statistics. What are the links between HIV and TB? Let's explore this further. Professor Harry Hausler joins me now live. He is the Chief Executive Officer of TB HIV Care Association. Professor, thank you very much indeed for your time. The combination of TB and HIV is a lethal combination, isn't it?
It is. TB is a leading cause of death in South Africa, in the general population, but as well with people living with HIV.
But that's shocking in itself, because TB is curable, isn't it?
Exactly. There's very good treatment for TB, but unfortunately we're missing a number of cases. We're not diagnosing all of the cases in the country, so they don't get put onto treatment, sometimes until late, and that can result in mortality. The estimate is that there are 450,000 people who got sick with TB in South Africa in 2014, but the national program only registered 318,000. So there were 130,000 TB cases, people who developed TB who didn't get put on treatment.
So TB now rivals HIV, isn't it, in terms of the leading killer in terms of infectious diseases?
Absolutely.
Yeah.
It does. And so what's very important for us as an organization, as TB HIV Care Association, I run TB HIV Care, and I'm also the NGO sector leader in the South African National AIDS Council. And non-governmental organizations like TB HIV Care aim to prevent, find and treat TB and HIV. So we need to first find people who have TB in the community, make sure they get put onto treatment, and then make sure that they complete their full course of 6 months of treatment if they've got drug-susceptible TB.
Yeah. What about the links between HIV and TB? What has been found thus far?
People living with HIV have a compromised immune system, which makes them much more likely to develop TB disease after being infected. So that's the main important link between TB and HIV. So the estimate is that 61% of TB patients in South Africa are also living with HIV, which means that we really need to provide integrated programs for TB and HIV. We have to make sure that one client with both diseases can get treatment in one clinic. And we've really made a lot of good progress in that regard in South Africa.
Enough progress?
It isn't enough. There are still, even within a clinic, sometimes there's a TB room and an HIV room. What we really need to go to is integrated care, so that as any person who needs treatment would go to one clinician and get both TB treatment and antiretroviral treatment if they're eligible. Yeah. The other important point that I want to mention is that TB can be prevented. So simple things like covering your cough, and then will prevent, because it's an airborne disease, so that will prevent TB from being transmitted in the environment. Opening windows in taxis, that's another way. For people living with HIV, there's something called isoniazid preventive therapy.
Yeah.
And we've got about 500,000 people on isoniazid preventive therapy in South Africa. But there are about 6.4 million people living with HIV. So we could really do more to ramp up isoniazid preventive therapy to prevent TB in people living with HIV.
We're looking at the links between HIV and TB. What about the links between TB and people with disabilities? Is that being explored?
There are links between TB and disabilities, and two important ones are a very serious form of childhood TB. TB meningitis can result in disabilities and paralysis in young children. And then also, if TB can actually affect almost any part of the body, but if it affects the spine, that can also result in paraplegia if it's not detected early enough and treated. If it's detected early enough, it can be treated just like pulmonary TB, TB of the lungs. But the other important link with disabilities is that the treatment that we have currently for multi-drug resistant TB includes medicines that can cause deafness. So it's very important to do audiometry to check hearing when someone starts on MDR-TB treatment, and to monitor carefully and change the regimen if deafness is one of the side effects.
Professor, thank you very much indeed for your time. Really appreciate your insight. That was Professor Harry Hausler, and he's the Chief Executive Officer of TB HIV Care Association. It's back to studio.